CBS 46 is your vaccine team. The United States has hit a new high in COVID cases among children. The American Academy of Pediatrics says more than 250,000 pediatric cases were reported just last week.
Here in Georgia, more than 34,000 cases among Georgia children were reported in 2 weeks ending last week, and it's taking a toll on classrooms across the state. At least 210,000 students in Georgia in 54 districts and charter networks have had to change their school schedules. That's more than 12% of the state's public school students. And those numbers are very alarming for both parents and educators.
That's why we're bringing in an expert to talk about the surge among children. Dr. Jane Morgan is the executive director of the COVID task force at Piedmont Healthcare. Dr. Morgan, thanks for joining us today.
Thank you for having me.
You just heard Rick mention the number of children and teenagers with COVID-19 exceeds 250,000 for the first time since the start of the pandemic. This is happening as masks and vaccination fights continue. What can parents do to protect their children?
You know, one of the things is we do need to be concerned about this. This is the highest level of infections that we've seen in children. It's more than 25% of all infections in the nation. And that's the greatest that we've seen at any time during this pandemic. We certainly want to make certain that we can create a zone of protection around our children. And that means that all of the adults who are eligible need to be vaccinated such that children have less of a risk of exposure, not only to themselves, but to others as well. Don't forget, children require a higher degree of contact and support. And so children actually transmit the virus much more frequently than adults because we're in closer contact with children as we are handling, managing, and raising them.
We heard earlier in the newscast, Doctor, from the governor of Florida, who is against mask mandates there. He said, let parents make the decision as far as what's best for their children, whether to mask or not to mask. Here in Georgia, we have Governor Kemp, who is also against mandates, saying that he just hopes that people in Georgia do the right thing. Are parents the best people to decide what is best for the health of their children, or should we be relying more on medical professionals like you?
Yeah, I think this word mandate, is also maybe a trigger word as well. And maybe we could find a different phrase to use, maybe part of the school attire or dress code or requirements. So I think mandate is also a word I think that sometimes triggers people. One thing that we certainly know from a scientific perspective is that vaccines work, and that the majority of people currently in the hospital are unvaccinated. We also know that this is the largest number of children that we have seen that have contracted the virus. And we further know that data is showing us that masks are effective and safe in helping with public health measures and keeping everyone safe, including children.
And doctor, we're also seeing here in Georgia where the ICU units are at capacity with COVID patients. We even have Grady today announcing that all non-essential surgeries will be put off until the COVID cases can come down. What message would you send to parents to vaccinate their children that are 12 and older rather, that have not done it so far? Is this critical to stopping the spread?
And I think one of the things that we need to think about is that we could be approaching these critical levels, as you have seen Grady making this announcement. As our hospitals become increasingly occupied by COVID patients, those are beds that now cannot go to other patients. People have other medical problems. And certainly with children, we can have choking hazards and any type of accidents, car accidents, and then also other things that can happen to people, heart attacks and strokes and diabetes that we need to manage. So we have to understand as well that while we're managing this pandemic, if we're not able to be vaccinated and we continue to be sick and hospitalized, then it really puts a strain on the healthcare system to treat other medical conditions that are also very important.
Dr. Jane Morgan, we're going to have to wrap it up from here, but very good advice and insight today. Executive Director of the COVID Task Force at Piedmont Healthcare, we definitely appreciate your time.
We do, and we hope that the vaccines will be made available to children under the age of 12 in the not too distant future. We'll be covering that, of course, as well. Thank you again, Doctor.